Hi, my name is Tegan Foster, and the genetic disorder I chose to research was acromicric dysplasia. So acromicric dysplasia is an autosomal dominant disorder, and one parent being affected by the disorder is enough to pass the gene to their offspring. In the Punnett square on the left, you can see a woman with the disorder and a man without the disorder will have a 50% chance of passing it to their offspring, either a female or a male, while the other two would not be affected by the disorder. So the prevalence of acromicric dysplasia is unknown, as there is a chance of less than 1 out of a million people having it and fewer than 60 patients actually being reported with the disorder. So the disorder is characterized by an extremely short stature, short limbs, and stiff joints, and spine abnormalities can also occur. The male average height is 4 feet and 5 inches, and the female average height is 4 feet and 2 inches. So the disorder can also cause slowed mineralization of the bone. Carpal tunnel syndrome is often developed, and usually it is in older patients that this is more seen than younger patients, and hip dysplasia can also occur. So at birth, newborns may have a round face, long eyelashes, upturned nostrils, a longer space between the nose and the upper lip than normal, and a small mouth with thick lips. And as development occurs, their height will fall below average. So there are two disorders that are commonly confused with acromicric dysplasia. The first being Moore-Fetterman, and a difference of Moore-Fetterman being thickened skin on the forearms. Geolophisic dysplasia is closely related, but is recessive instead of dominant. So both parents would have to have the recessive gene to pass it on to their offspring, instead of only one person needing the affected gene, as in acromicric dysplasia. All right, so the gene responsible for acromicric dysplasia is the FBN1 gene, which creates fibrillin 1, and fibrillin 1 produces microfibrils, which provide flexibility and strength for connective tissues and store growth factors. So that would lead to the stiff joints and the stunted growth of people that are affected by this. So those mutations change single protein building blocks in the protein. So they cause a reduction and the disorganization of the macrofibrils. And this disorganization causes the growth factor to be abnormally active, which likely contributes to the stunted growth later in life. So there is no treatment for the disease specifically. It tends to be supportive and symptomatic depending on the person. And it is non-lethal and causes no major complications in life.